keeping cool. I think you all know that my name is Io Harrington, and I am happy to announce that I am no longer the chair of New York City VOAD. I, in fact, am the co-chair once again, and my co-chair, happy to welcome back, is Racine. Racine is out dealing with the national emergencies today, so she will not be with us so far as I understand. But she will be rejoining us throughout the next several months and at our next meeting, which is in September. Um, so we have a full meeting this morning. We have 3 speakers. I'd like to get to them right away. Let's see. Dr. Foote is not on. Is that correct? Yet? And that's fine. We are going to go to another speaker, and her name is Jessie Lang. She is the Deputy Director of Policy at the Office of the Manhattan Borough President. We have asked her to brief us on the Borough President's priorities, challenges, any successes on resiliency for the Borough of Manhattan. And as a reminder, for each of our meetings, we will be asking for a presentation from each of the Borough President's offices, who have each appointed someone as their resilience person, whatever the title might be. So without further ado, Jessie Lang, welcome to New York City VOAD, and we are happy to hear what the plans and priorities for the Borough of Manhattan might be.
Hi, yeah, thank you so much. I am very excited to be here, and I really appreciate the invitation and the opportunity to speak to you all today. So as mentioned, I'm the Deputy Director of Policy in the Manhattan Borough President's Office. As many of you may know, Brad Hoylman Sigal is the current Manhattan Borough President. He has been in this position since January of this year, following being elected last year. Prior to that, he was serving as a state senator for, I believe, 12 years up in Albany. And my position in the office, I've actually been in the borough president's office for about 3 years. So I started under the previous borough president and stayed on when Brad started. And really the issues that NYCVOAD advocates for, responds to, are very, very near and dear to my heart. And I'm really excited to be working on a few things related to resilience, disaster preparation, and response. So I did just want to talk through what a few of those things are and kind of what the borough president is thinking about in terms of resiliency for our borough. So I think I don't need to tell you all that disasters and like extreme weather and other emergencies are very much on the rise in Manhattan and New York City and really across the region. I think the one that we are really thinking most about is climate change, and just all of the downstream impacts related to climate change that we are very much starting to see in across the city. One of the things that I'm actually working on right now, some of you may remember that in fall 2024, we had a historic drought in the region, and that resulted in 270 brush fires in New York City in just a 1-month period in November 2024. And we've been really taking a close look at what has happened since then. I think that this is one case where the fires happened, the drought happened, and then it passed, and the city was incredibly active in responding to the fires and putting them out and getting them under control when they actually happened. But where we really want and need to see a more proactive approach from the city, because with climate change very much here, it's not a question of if we have another major drought in New York City that puts us at risk of additional fires, but when. And I think that's really how we're thinking about disaster planning in the age of climate change in general, is that there is a real need to acknowledge and be like very clear that these extreme weather events are happening, and we really can no longer say like I think we all that I historically we've often used the terms like 100-year storm and historic weather events, and now we're really seeing that like we are breaking records for flooding, for drought, for heat, every year now, and that is really going to continue. So uh, it's really important, I think, that we really start to take a proactive approach in thinking about um, what those events and disasters uh, are going to be, and how do we prepare our city for them, not just to make the infrastructure of our city more resilient, but also to keep New Yorkers safe when they happen. And today is a great example. We have we're in a heat wave right now. It's going to be over 100 degrees today. And we also later this afternoon are going to be it looks like we're going to be having really significant air quality problems due to wildfires that are happening in Canada and Minnesota, that the smoke is coming down to us. And so I think that you know, when these types of events are happening in the city, um, getting, responding to the actual event that's happening and making sure that New Yorkers are prepared, know what they can do to keep themselves safe is really of utmost importance. And so we have been really making efforts to spread share and disseminate the official messaging from New York City Emergency Management, from Department of Health when that happens, and say, we know that not many people are not signed up for Notify NYC. People get their information from a wide variety of different sources. And so I think that we're very much thinking about how can we play a role in, sharing this information on our newsletter, sharing it on social media, but also making sure that our staff and volunteers of our office out in the community also have the information about what's happening in our borough, what Manhattanites need to be aware of. If the smoke conditions get really bad in New York City, people need to know things like if they should be staying inside, if they have health conditions, or consider wearing a mask while they're outside. And so we really want to amplify the messaging that NYCEM and other city agencies are doing, that is coming from the official source, from very, very smart people who are very much paying attention to this and are experts in what to do to respond to an acute emergency, and just making sure that people get that information. I think that after the fact, after there is sort of like a acute emergency, um, the next question is like, well, how do we prepare for the next one? What can we learn from a historic flooding event? What can we learn from extreme heat? And then how can we both, tailor our messaging to make sure that people are getting the information that they need, but also ideally be really working towards a more resilient city that isn't one where when we have extreme rain, the subway system shuts down because of flooding. And so I think there are some areas there where we're very hopeful. Um, One thing that I have been closely paying attention to is that you may be aware of the several charter revisions that passed last year that were on our ballot. They were mostly related to making it easier and faster to build new housing, especially affordable housing in New York City. But one that I think has kind of flown under the radar is around making the process for street grade changes easier, and that's something that has a direct is directly related to flooding. So one major issue in New York City is that as the city has resurfaced its streets over and over and over again through the many years, the difference between the street grade and the curb in a lot of areas has shrunk, and that is something that is making it so that flooding is getting onto sidewalks. It makes it easier for flooding to get into people's basements, and it also makes it easier for flooding to get into the subway system. So the charter amendment that was passed last year really helps the city speed up when it wants to do a major street grade change to address that resiliency. Previously, it was very, very long, very burdensome process, and really, expensive and challenging to just get through the process, not to even actually do the actual work. And so we are really excited that this has kind of given the city now more more ability to be responsive and act quickly to address that. But I think that there are lots of other opportunities where we need to look at, like, where is the bureaucratic process of making these types of resiliency improvements slowing us down, and making it so that we can't be responsive to or as easily or quickly responsive to what is happening in our city. And yeah, and it's really important that we take a hard look at that. And then the other thing that I wanted to speak on a little bit is just because I know that this is something that is so important for the work that VOAD does, is really the partnership with nonprofits and faith-based organizations. I think one thing that I really saw during the COVID pandemic, when it was really like the acute phases of the pandemic, and then once vaccines were available, was the really, really instrumental role that community-based nonprofit organizations and faith-based organizations play in getting information to people in communities. And oftentimes, we're talking about complicated issues, issues where people have reason to be distrustful of government and government messengers. And when we can, I really think that when we can partner with community-based and faith-based organizations, that these are the people who have real roots in the community, and is a huge opportunity to not only just simply get the information to people, but also learn from these organizations who are talking to New Yorkers every day about what their concerns are, what type of messaging gets through to them, and really just what their needs are as well. I think there is a really powerful opportunity there, that yeah, as I said, I saw it happen a little bit during the response to COVID. And I think it's something that we could really build on when talking about disaster and emergency planning and response. So that is what I had kind of prepared to talk about, but happy to answer any questions if there's time for that as well.
Thank you. We really appreciate it and really would appreciate collaborating with the Borough President's office on an ongoing basis. Of course, most every organization that's a member of New York City VOAD participated in some major way throughout the COVID pandemic.
Mhm.
Um, um, Zach, I was just actually going to ask you to put this view on, and if our members can, for a moment, just raise your hand for Jessie so that she can see which of our members are Manhattan based and or citywide. If our members can just do that for a moment. And of course, Jessie, we will also send you a list of those just so that you're familiar with them.
Thank
You
you.
see already lots of hands that are being raised. Of course, New York City VOAD, and some are being raised physically.
Mm.
So there you are. We definitely want to get to Dr. Foote, but are there any questions for Jessie? Okay. Seeing none at the time, Jessie, thank you.
We do have
Oh, I'm
Andrea from
sorry. Go
Catholic
ahead.
Charities.
I'm sorry. Go ahead.
No, I just have to lower my hand. Sorry about that. Apologies.
Okay, you're free, Jessie.
Thank
You're welcome
you.
to stay with us. We have two more people who are going to be presenting. And thank Brad as well as
Yeah, thank you. Yeah, thank you so much. And yeah, I am interested in tuning in. I know that Dr. Foote is going to be speaking about the Legionnaires cluster, which is something that our office has also been working very closely on getting information about. But I didn't want to preempt what she was going to say since she is really the official source on this.
excellent, excellent. So Dr. Mary Foote is with the Department of Health. She has a bunch of degrees and titles, but she is also the medical director in the office there of Emergency Preparedness and Response. And so we've asked her to provide us with some education and updates about the Legionnaires disease. And Dr. Foote, we did not ask you to. But if you can also just touch on at some point the other unwelcomed bacterial infection that is creating problems, medical problems for New Yorkers, we would very much appreciate it. So without further ado, Dr. Mary Foote.
Hi, everyone. Thanks so much for inviting me. Let me pull up the slides, and I apologize ahead of time if you're looking for cryptosporidium for the crypto explosive diarrhea outbreak. I don't
Yes,
have,
that was it.
yeah, unfortunately, I don't have talking points prepped for that, but I can get you follow-up information. We just sent out a health alert about it yesterday, so I can pull together some information for you.
Perfect. Thank you.
Yeah. So. Sorry, I'm trying to. We are not Zoom proficient apparently in the health department.
Oh, you would not be by yourself.
All right. Okay. Are you seeing the right screen?
Yes.
Okay, great. Okay, so thank you, everybody. I know this has been a lot in the news, so it's a pleasure to be able to join you to talk about what's been going on. So we'll, of course, talk about just a general review, some of our frequently asked questions, and then just give you some updates. We had another press briefing yesterday, so there's kind of a little bit of new information to offer. So what is Legionnaire's disease? You may have already heard all this by now, so apologies for repetition, but Legionnaire's disease is a specific type of pneumonia that is caused by a bacteria called Legionella pneumophilia. This is a warm, sticky, tropical climate loving bacteria, so it grows really well when conditions are right, like right now in this warm weather. And it can cause, when you first get infected, it can cause flu-like symptoms, but also significant complications in those that are higher risk. Symptoms can include fevers, chills, muscle aches, and a cough. And often it's a dry cough. You might have also headaches, fatigue, loss of appetite, confusion, or diarrhea. And this is kind of our main talking point for anyone in the community, anyone in these symptoms in the impacted zip codes should seek medical attention right away, because really this is something where the sooner you treat, the much better outcomes you're going to have. And so who gets Legionnaire's disease? Most people, like, I just want to be very clear, like Legionnaires, it's in the environment. Legionella is in the environment. We're probably getting microdosed with Legionella all the time. This is a very common ubiquitous bacteria. But so in that case, most people do not develop Legionnaire's disease. They get exposed because you really, one, need kind of the risk factors that we're going to talk about, but also you need a really much higher infecting dose than we're normally exposed to. Legionnaires is extremely rare in babies and children, and we do get asked about this a lot, but it's never seen in pets. But really, most important is the highest risk groups, the ones that we really do see develop more severe infections are those over the age of 50, people who smoke, or with underlying health conditions such as lung disease, diabetes, or various types of immunosuppression. And so how do you get it, particularly as it relates to outbreaks like this? So people really can only get Legionnaire's disease by breathing in water vapor in the air that contains the bacteria from sources such as cooling tower. And again, this is very specifically, you need like pretty high doses of the bacteria in the water to really get infected. So the likely source of the Legionnaire's bacteria, particularly in outbreaks like this that are the larger ones, is really a cooling tower, and in this case, in the Upper East Side. So these cooling towers, and we always like to be very clear, differentiating between cooling towers, which you'll see on the left side of the picture, versus a water tower, which is really just kind of a storage container. So the cooling tower is what, just the way it works is it's cooling central air, air conditioning systems, but it then creates an evaporation of mist that then gets pushed out by fans, that can get pushed out by fans into the environment. And um, so this is really kind of the case. The concern is when, there is an overgrowth of Legionnaire's bacteria in this kind of cooling tower system that then can cause the outbreak. How do you not get it? People cannot get Legionnaire's disease so basically you can't pass it person to person. So it's not contagious. It does not come from drinking water or using like your own air conditioning systems, especially like window units. People are often concerned about that. Air conditioning is not a risk factor. So how do we know this is from a kind of cooling tower versus something with the indoor water systems like the pipes? So we can see outbreaks kind of in both of these scenarios. With building investigations, that's really related to growth in the pipe system of a building. So that's with the potable water systems, those tend to be much smaller outbreaks. That's really if there's an overgrowth of the bacteria. And then things like showers that can cause mist can sometimes cause infection if there's a high enough dose of the bacteria. Those are usually much smaller. We really consider triggers an investigation if we see 2 cases within 12 months in the same building, and that would trigger an investigation. We do see, again, just really want to reiterate, because Legionella is so ubiquitous in the environment, we do see sporadic cases, throughout the year, but really, we really pay, a lot more closer attention to, respond when we see, at least 2 cases, like we said, in a year in that case. And then the community cluster, we're looking for, it may not necessarily be associated with one building. So we're seeing cases, maybe in people that are in addresses within a very close proximity to each other. So this is like a special software that we use, when we see a case, we have the address of the person who tests positive. And then if we see a signal where, these people are living very close proximity to each other, that gets our attention and makes us take a closer look at a potential outbreak. And that also indicates it's much more likely something that's exposing people in the environment around the neighborhood, not within a specific building. And so some of our frequently asked questions, should I wear a mask? And we can certainly get more into this because I know this is a question people ask a lot. Our short answer is no. But, one, if you're thinking about wearing a mask because you're worried about transmitting it, as we said, it does not go person to person. Um, a regular face mask wouldn't necessarily be protective. If you're talking about a respirator, we can go much more into the details, but really we don't recommend it because, or it's not necessarily gonna do much good because, like, basically you'd have to be wearing an N95 mask at all times, like when you're walking around the world, like we said, because it's so ubiquitous. But really, when we detect an outbreak, I think it's really important to differentiate. When we have an outbreak, there's an incubation period between exposure to when you develop symptoms that generally is between, can be up to 10 to 14 days. So when we're detecting a cluster, that's really showing us something that already happened probably more than a week ago. And so by the time we detect it, probably the highest risk is over already. And our response, in terms of like the big exposure event that happened to infect people, that was something that probably already happened. And so the risk is probably at that point even much lower, just generally. But then we so quickly respond once we detect a cluster, once this is kind of detected and announced publicly, where the zip codes are, the remediation happens very quickly. And so, there's kind of two things that the building owners do. One is increase the chemical biocide that just kind of kills off the bacteria that's kind of overgrowing. And so that can happen very quickly. And then now we're asking people to actually, if we detect Legionnaires in any of these cooling towers, even just dead or alive, just the presence of the bacteria DNA, then we are now ordering a full drainage, cleaning, and disinfection. So that all happens very quickly. So really kind of at the point where you're kind of asking that question, the risk is probably very low in terms of your exposure walking around the environment. I don't know if that helps explain things, but we can answer more questions later if you have them. So how do I get tested? So there's no real screening test. It's really just if you have symptoms that we would test, which is again why we encourage you to come in very quickly so we can test you and get you treated, before you get too sick. Is it safe to be in a building that tested PCR? So the answer is really the risk of being inside a building is the same as it would be like walking outside in the environment. So it's not a particular risk from the air inside the building. And are babies and children at risk? Legionnaires, like we said, in children and babies is extremely rare. We haven't seen any pediatric cases in this or recent outbreaks. Pregnant people are not at increased risk for Legionnaire's disease. Someone who is pregnant or has another risk factor, such as lung disease, of course, may be at that increased risk, but pregnancy itself is not a risk factor for severe disease. And is Legionnaire's preventable, meaning before there's ever, exposures? The short answer is no, in terms of there's no vaccine, but it does respond very quickly and easily to antibiotics for the most part. Again, if you're treated early on, that's much, much better for you. So anyway, we'll keep reiterating. If you get those symptoms and you live in that area, seek care soon. And then the best way to prevent Legionnaire's disease community clusters is really on the building owners to properly maintain the cooling towers according to our very strict, probably the most strict regulations in the country. So situation update, what's going on right now. So this is as of this morning. We now have 63 cases confirmed. 12 are currently in the hospital, 40 are discharged. And really remarkable and very happy news is that we have had no deaths. So that's really, really wonderful. That means, this was a fast response. People are getting care that they need, quickly. And this is a really good sign that we haven't had any deaths. And this is, of course, I think after COVID, everybody knows what an epi curve is. So this is really looking at the cases that we're getting daily. And so basically, we get a positive test reported to us or a case. We go back and we look at what was the day that their specimen was collected. So, somebody goes in, they get their urine collected for a test. A couple days later, they'll get the results. So we add this case as on the day that they got the test. So that's, this is why, even though you may see cases added, in the next couple of days, or you might see cases getting added, a couple of days previous, each day on this Ebbie curve, but that's why. So we're kind of like still getting rolling reports. So maybe added, to previous days. But this is wonderful. This is exactly what we want to see. We had this initial, because of the, up to 14-day incubation period, you expect to see, kind of a week or two of higher cases. But, this is exactly what we want to see and that shows the remediation worked really well, is that by, day 14, day 13, we really are seeing a very significant drop off in cases. So that means very good sign that the source was remediated very quickly. And so in terms of the cooling towers, the Upper East Side is a very dense, of course, as we all know, very dense neighborhood, and there are a lot of big buildings with cooling towers in them. So we have sampled 183 cooling towers in that zip code, and then we have kind of a wide extra perimeter that we're also testing. So PCR positive tests, so of the cooling towers that were tested with that very initial screening test with PCR, 76 tested positive. And so 57 of those confirmed that they have already completed all the required remediation, and the remaining have confirmed that they will be completely finished by tomorrow. And we have been posting information on the buildings on our website. But I think this is, very important to note the differences between the different types of testing and kind of the sequence of the testing that we do for these outbreaks. So when we detect a cluster, so we detected this on a Friday afternoon going into 4th of July weekend. Immediately, we had people, our environmental engineers, going out to these cooling towers all over these zip codes, collecting samples throughout the weekend. And then what they do is they take these samples, especially, ones that are probably the most concerning. We prioritize those for the testing, and that's a PCR test. So that is a quick test that tells us really just, do we have DNA of the bacteria detectable? That does not tell us whether or not this is a live bacteria that could be potentially causing the outbreak, or it could be, just remains of dead bacteria that were killed through the regular kind of maintenance and biocide process. So that really just tells us, like, is there even a potential risk that this is a source? And so that really directs the rapid action of ordering these buildings to clean and remediate. And then, of course, from those samples, we also put them into a culture, and we're just looking for active growth of bacteria, meaning these are live bacteria that are still growing and could potentially have been the source. So that takes quite a bit of time, 10 days to up to 2 weeks for this test to grow. And so that, again, it's not telling us exactly that this is the source of the tower, but this is telling us that this is a building that needs to, be more on top of and very prioritized for remediation. When we really can figure out the source of an outbreak, and sometimes we never figure it out because we need a patient sample to match. But from the cultures, we can then do DNA sequencing, basically a DNA fingerprint. And then what we try and do, which is a lot harder, is to get a patient culture from, their lungs or, from their sputum. And then we try and match the fingerprints. So like I said, sometimes it's really hard to get a patient sample just because, people are already put on they get different testing than a culture, then they're already on antibiotics, and then cultures don't grow very well once you're started on antibiotics. So that's much harder. So sometimes we don't necessarily get enough of a patient sample to do the match, but that's what we're trying to do. And so our key actions, we have, like we said, sampled and tested the water from all the cooling towers in the area of the cluster. All of the building owners with the positive PCR have been ordered to, one, disinfect, to drain and scrub down their cooling towers, because one of the risk factors, for continued growth of Legionella is this kind of slime layer that can build up, especially in warm weather, that sort of protects the bacteria and allows them to continue to kind of grow slowly. And also it helps get rid of just the mineral deposits that grow, because that also just creates little nooks and crannies where bacteria can grow better. So that's really why we order them to drain and scrub as well. That's a really important step. And then we, of course, follow up accountability just to make sure that all that work has been completed and then retest. And then we continue to do, like we said, continue to retest to determine, to make sure that, the remediation steps work. Okay, and those are the prepared slides that we have. So I am happy to answer any questions.
Excellent presentation, and I'm sure that there are lots of questions. I know I have at least 5 or 6 myself, but I'll open it up to the floor. Are there any questions? I am looking at just one window, so I don't see any raised hands. So I am going to begin. The first question, Dr. Foote, you may not know the answer to, and that is how often are buildings required to test their cooling and or water systems?
So the cooling towers are very specific regulation. It used to be every 3 months, but since the outbreak last year, it's now monthly.
And who do the reports get sent to, and is the public able to access it?
Yes, they are able to access. I'll have to look for the website, but I believe it goes to our Division of Environmental Health. But I'll have to look up the website with the information for you.
Okay. If you can get back to us on that, that would be very helpful.
Okay.
Appreciate it. And then on the question of mask, as I said, most of us were involved in COVID. And I think that the messaging then, especially in the beginning, was we didn't have to wear masks. So I understand what you're saying about this. It's totally different. But wouldn't it be helpful for the messaging to be, especially when there's a cluster this large, uh, out of an abundance of caution, to maybe consider it?
I mean, I like I said, I mean, by the time we are detecting the cluster and doing the investigation, I mean, obviously masks are a personal choice. And if somebody, especially if somebody is in that higher risk category, is really concerned, it's certainly not wrong. Um, but at that point, the risk is extremely low. Um, and so, that's kind of can be a personal choice about, do you want to be wearing, an N95 mask at all times, in your environment to protect yourself? Totally, totally reasonable if you're really concerned about your health. But at this point, I don't think it's necessary to issue a blanket recommendation to do so, just given the risk.
Understood. And there were lots of questions during this event around testing. And thank you for explaining when it might be needed based on the symptoms, so on and so forth. But even in other situations where the cause is located within the water system in a building, so it's particular to a development, so to speak, um, residents might want to get tested. and some can afford to be, some may not have a primary doctor. And I know with COVID, eventually the testing was free to anyone who wanted it. So just something to think about in terms of policy within the city government, especially as it relates to health and H&H hospitals, right?
Mhm.
If that is something that you can share wherever you can, I think that we would all appreciate it. And then the last thing that I wanted to mention was when it is discovered within a building, in the pipes and I don't know what the technical terms are, but within the pipes, the water system, and residents are, it is recommended that they not take hot showers. It seems that the response to a cluster from the city is quicker, and it makes sense. There are more people that are affected, but many have suggested that the required notice to residents happen as soon as there is one person with confirmed case in a building. We know that the policy for DOHMH is that it's, 2 cases within a 12-month period. But considering that most buildings don't actually do the testing as is required, might it make sense to reconsider that policy? And I know that decision is not yours alone, but
Yes.
that's part of what is being discussed.
Yeah. Yeah. And I understand that concern. I mean, I can just say that, like we said, because we do have sporadic cases, that happen one-off quite
Mhm.
often, just because it is so ubiquitous in the environment. It's just with just one isolated case, it's impossible to know if that has any association with the building or if it was due to an exposure anywhere else. So that's why, it's really the 2 cases is considered the trigger.
Right.
But I
Well,
will certainly reiterate your feedback. I know they have heard
yeah.
that.
Thank you very much. Appreciate
Yeah,
it.
no problem.
Are there any other questions for Dr. Foote? Zach, can you help me with this? Do we see any raised hands? Okay, well, seeing none, thank you so much for the presentation. It is much appreciated. We always appreciate you coming and DOHMH coming to share and support New York City VOAD.
Oh,
Thank you so much.
our pleasure, and we're appreciate the invitation. So thank you.
All right, take good care.
Thanks.
So we are now going to go on to our last speaker for today, and that is someone who is also no stranger to New York City VOAD, and that is Dana Nelson, who's the program manager for Human Services Unit at NYCM. Dana is going to share with us, most appropriately, considering today's weather, some information on extreme heat in New York City, which of course we are experiencing, as Jesse pointed out, more and more every year. So Dana, thank you for coming and welcome.
Thank you for having me. So thank you. We are currently in the middle of a heat activation, so we are very appropriate. Just I want to preface, again, my name is Dana Nelson, Human Services Program Manager. My main portfolio is service centers, emergency vacate protocols. And when we say main portfolios, is because emergencies don't happen all the time. So those are the plans and policies and activations that we set in place during our blue skies. So I want to say that because I'm also the VOAD liaison. I make sure I attend each of these meetings and I know what's going on with VOAD, and I am like the direct connection between VOAD and New York City Emergency Management. So that is a preface to say that this is not my everyday plan. And so I wanted to have the experts come and speak to you guys today and kind of be able to answer all the wealth of questions that you may have in depth. But unfortunately, because we are in the middle of the heat plan and we are in the middle of the summer, they are very busy. So they have passed along this information for me to be able to present it to you. So I'm going to give it to you to the best of my abilities. We have, just complete basic slides, and I will be able to answer as much questions. I am familiar with the plan. I do know how to activate the plan. I do know how to work the plan. But if there is more in-depth about policy and things that we should do and all of that, I can definitely take that information back and get answers for you guys if it's something that I'm 100% familiar with. So I want to give a very fair caveat on what my capabilities are today. So with that being said, we're going to get into the emergency heat plan. What is the emergency heat plan? The emergency heat plan, we activate that. We have to meet a particular kind of triggers. And it's not just a very warm day, like when it's in the 80s, but it's it is a trigger of 100 heat index of 100 degrees or more, and in one day, and a trigger of 95 degrees or more for multiple days, for 2 or more days. And the heat index is basically not the actual temperature, but what the temperature feels like. It's what we have in the winter when we say it's 15 degrees, but it feels like 0 degrees. It's the same thing in the summertime where it is a 95 degrees or it is 93 degrees, but it feels like 105. It feels like these particular triggers. And so it is what the body feels like based on temperature and humidity. So when we activate the heat, we are activating with particular objectives, which is to provide hazard awareness and disseminate information, to minimize impacts in public health, and to minimize impacts on infrastructure. And the way that we do that here in the New York City Emergency Management is when we activate the heat plan. Here, we are a commissioner, or our first deputy commissioner said we're activating the heat plan. There is a heat warning, or there's a heat watch, and we're activating the heat plan. And so what that means is that we're going to be holding steering committee calls where we have interagencies, all the agencies across the city come in and do report outs on what their stance and posture is for the heat for the heat response, for the heat emergency. And we also and we have those are daily calls, usually prior to the actual start of the heat act, the high temperatures, and usually like the day of or the day after, we will have those steering committee calls. So it is at any time. We have it through the weekends, through the holidays, through the whole thing once we activate the heat plan. And then the next thing that we do is that we deploy AWS messaging. And so that's when we send out, to the agencies and to the most vulnerable population. There are organizations that sign up for our AWS messaging, and it's AWS messaging that's aside from what we put out with Notify and so on. It is particularly speaking to the vulnerable population, and so those people that are more susceptible to heat or more susceptible to whatever the emergency winter weather, whatever their the temperatures or the hazard is at the moment. So we will put out a AWS messaging speaking particularly to those populations. We will also convene an AWS conference call. And so the AWS brings together those umbrella agencies that have a vulnerable population that may be susceptible to the health hazard. Basically, it is we will do end stage renal failure. We will do God Love We Deliver. People that have Department of Aging, New York City Aging. So it is those umbrella agencies that deal directly with a vulnerable population, and we have the AWS conference call to, number one, support those agencies. So is there anything that NYCM can help to support, any messaging that we can incorporate, any kind of, any kind of infrastructure issues that you may be experiencing that NYCM can support through our resource gathering and just making coordination efforts between agencies. So we have that discussion for number one, so that we can provide the support, but also so that we can know what is happening with the vulnerable population and make sure that those touch points are being done. So we want to hear that the agencies are doing call downs, the agencies are making contact with those that are maybe homebound. We speak with Con Edison to see what they're doing for their vulnerable population, PSEMG. We have those kind of wide range of agencies that have vulnerable population within their clientele to make sure that they're making those touch points. So, and then the next thing we do is we activate our cooling center plan, which I will get into a little bit later. And so it is, again, to provide cool spaces for individuals to get out of the heat and be able to find respite. You know, as everyone is very much aware, it is one of the number one killers in New York because people either cannot afford to turn on their AC, or they do not have an AC, or they're just in a vulnerable situation where they're either unhoused in different situations that allow them to be exposed to high temperatures. And so we provide those respite and areas for relief. So we have what we call also now is the cool options. So our cool options is, again, our actual plan is triggered in that heat index of 95 degrees or more, but there are still very warm days where we may not trigger a full heat plan. So in those warm days, we have a finder activated that shows cool options, and those are spaces that are outdoor. Those are spaces that are outdoor that also provides cool options. So it's like whether there's a sprinkler, whether there's a shaded area, where there are different areas, whether there's shaded areas, where there are different areas. I'm sorry, can you give me 1 second?
Sure.
Sorry, it's when you have a shared space. And so whether it's outdoor cooling areas, whether it's areas that are just generally open where it's a shaded block, it's a park, you know, it's different areas that are cooler throughout the city. We kind of identify those spaces when we are not currently in the heat activation. And then when we are in a heat activation and during heat emergency, we turn on our cooling centers. And so we message out to the cooling center partners to let them know once you are a cooling center, you are now open to, and most of the spaces that we use are already kind of open to the public, but it's kind of like this special there's like no one gets turned away. We're currently in the middle of a heat emergency. And so you make this space completely available to whoever comes in to be to find respite out of the high temperatures. And so the partners that we work with consistently is New York City Agent. They have the largest population of cooling centers, so they usually use their senior centers, their senior centers and senior community centers to be able to open up to the public. Usually, there are some centers that are 65 and older. There's some centers that are available to anyone, but on the cool option on the cool finders, when we have that activated, it kind of gives those additional information to say these are spaces that are now open and what age restrictions are and what other restrictions may be for the space. We work with Toote, which is part of the VOADs. We work with also, you know, and if you are interested, if you have a space, because it has to be at least be able to hold 10 people or more. If you have a space that you're interested in, we can, you know, send out our site surveys where you can provide additional information, and we'll call and give follow-up to see if the space that you have is suitable to be a cooling center. New York City Library System is one of our largest partners, which is what, you know, throughout the city. It's BPL, QPL, and NYPL. And basically we work with them. We have now museums have started to be part of our network. So it's the Brooklyn Museum. I think we had a new museum this year. No, because I think BAM was also part of our program this year. So we're always recruiting and more than open to working with whatever space is available. Petco, it is a pet. We use that as our pet friendly spaces. And so you go into Petco, you're able to, you know, we'll provide water for the dog and provide respite for the dogs as well as its owners. So those are our partners. Those are our areas that we do. And then more cool options are there's sprays, sprinklers, public parks, outdoor pools, different types of options that we kind of put on the cool options finder. During an heat emergency, there's like hundreds and hundreds of more, but also non-heat emergencies, we have these spaces available for people to be able to cool off. New partners for this year and new initiatives that kind of started up for this year. We are now working with H&H in the 11 hospitals. Again, they are, once we are activated in a cooling center capacity, they are now open to the public to be able to have a space for an individual to go sit down and keep cool. Again, water is available. We want to make sure that potable water is available, a space to sit down and a space to keep cool. So there are emergency room areas and different areas throughout the hospital. Usually they have it designated where a person can go in and cool off. New York City Department of Health has also opened up 3 spaces, again, in these neighborhoods that you would be able to go in, sit down, cool off. And so those are additional wide spaces. And again, there's more resources there, water, electrolytes, different kind of options that New York City Department of Health is New York City Health. Sorry, make sure I say that right now. New York City Health makes available during our heat activation. Again, this is during the heat activation. They're not part of our cool options, but when we are activated, they are placed finders. And then the cool outreach vans, and this is a H&H initiative. They're the partners that is responsible for this. They then have these cool vans where they will so during heat activations, the DHS and DSS has homeless outreach. And so they go to known homeless hotspots where they engage in the partners. And that's here. Code red is when they do engagement. Level 1 is when they do engagement every 2 hours. And level 2 is when they engage more and do outreach every hour. And so part of supporting some of this is also having the outreach vans kind of also go into known homeless hots, for lack of a better term, but known homeless areas, encampments, and try to again offer resources, provide wellness checks, medical care, essential supplies, different things to the population. But they also work very close with New York City agent. And so during the last activation during July 4th, we had a number of transports where they checked on the elderly and the homebound and were able to transport them either to a cooling center or either to the hospital or whatever resources that they need. So they also do outreach in these cool vans. And sometimes the vans are just there to just still give a space for a person to sit down for a little while and cough while receiving wellness checks and follow-ups and more additional information. That is my presentation. And if you have any questions, please feel free to let me know.
Thank you, Dana. Excellent. And thank you so much for doing this, even though you claim not to be an expert. Pretty expert information, it sounded like to me. Are there any questions for Dana?
There's a question in the chat from Lucy.
Okay.
Do you provide any support to designated cooling centers that are not city-owned spaces, like water delivery or air purifiers?
So again, we partner with all these spaces, so we don't own any of these spaces. It is all complete partnership. Salvation Army is one of our partners as well. So it is a complete partnership. We can support, we ask that you are able to provide potable water and able to, in order to be a cooling center, to kind of have these resources on your own. But we do things like for air quality control, we do distribute masks to like New York City Public Library. We have like in the day like today, we ask that because the air quality is the AQI makes our triggers. Again, we also, because there's always an air quality issue, so we have a particular trigger. And so when the AQI reaches that higher level of triggers, we ask that New York City Public Libraries distribute masks to those that come in. And so we will provide certain things like masks, but we don't provide any other kind of, unless there's like a mandate from City Hall, or there's an extreme emergency where we kind of see like, okay, there's an additional need here. But just on, I don't want to say an average, but just on a usual heat emergency, no, we don't provide air purifiers. Sometimes we can support on what else, sometimes with water or, again, in those extreme circumstances, but we do ask that you are able to kind of provide these things in order to be a service center.
Thank you. Another question, the cooling centers that you partner with, are they required to have seating?
Yes.
Okay.
Yeah. So yeah, we want people to be able to come in and sit there on it if they want to stay for an extended period of time.
Okay, and you mentioned a form, is there a form, that you can send to us, that we can
I
use to
will. Mhm.
recommend, other sites? Or,
I
or,
will.
so-
I
or
will.
some method?
Um, yes, yes, yes. So we have our site surveys. I'm sorry I wasn't prepared to drop that in the chat today. But I will make sure that I send it to you to the UIO and Zach and the board to make sure it gets to your members.
Perfect. All right, are there any other questions? Okay, well, we're a little bit over time, but this was all very informative information that is timely. And so we hope that that was helpful to all of you who attended. Thank you so much. And want to thank again Dr. Foote, Jesse Lang, and Dana Nelson for their presentations. We will be sending out very shortly the meeting dates for our 3 committees. And we will see you all again on Zoom and or in person at our September meeting. You do know that we are now meeting every other month, unless otherwise needed. And also thank you to Zach, who is always so supportive in making sure that the pre and the post and the during meeting stuff happens. All of you have a good day, have a good summer, and try to beat the heat. Have a good one. Thank you.